Personal health records, the missing piece. The personal health record. The personal health record, definitions and functions, Jacqueline Quantrill. PHR definitions. Defining the personal health record continues to change and grow as technology advances. Several organizations are playing a key role in this process. Electronic PHR is referred to as a private, secure application through which an individual may access, manage, and share his or her health information. Controversy exists regarding exactly what information should be used, allowed, or accessed by the health consumer. Some feel that only information from providers and clinicians should be included, while others believe the patient should have the opportunity to input his or her own information. Attributes of an ideal PHR. According to the Markle Foundation, each person controls their own PHR. It should contain information from an entire lifetime, contain information from all healthcare providers, be accessible from any place at any time, be completely private and secure, have complete transparency by seeing what, when, and why information was accessed and by whom, and permit easy exchange of information across healthcare systems. PHR functions. The functions of a PHR are to create easy access and fluidity of information exchange between the provider and patient. It can also provide education to the consumer of health services. When a lab test is ordered, a small box would appear to explain the test, why it is necessary, and what the results will tell you. This would enhance medication education as well. PHR functions. There are 5 major features and functions of the PHR. Access to EHR provided health information, secure messaging, self-entered data, proxy or delegation access, and administrative and financial data. This is an example of a personal health record. The Benefits and Barriers by Gillian McGovern. The electronic personal health record's benefits. The PHR record that is tethered to a health system's EHR can allow patients access to current medication lists, test results, provider visit histories, visit summaries, online medication refills, and secure messaging with the provider. Patient benefits. Having access to an electronic personal health record empowers the patient to become a more active participant in their health care. Health diaries can be kept by the patient at home and allows them to record vital signs, weights, and blood glucose levels. The provider can then access this information as needed. PHRs can reduce the number of visits and phone calls a patient makes to their provider by integrating medication refill capability, appointment scheduling, appointment history to keep track of previous well visits, secure messaging to triage symptoms. Untethered electronic personal health records are portable. They can be accessed anywhere when a secure connection is available. They allow patients to communicate with and inform other healthcare providers effectively about past and current health conditions. Provider benefits of PHRs. PHRs provide an ongoing connection between the patient and the provider. Having more data can help clinicians make more informed and better healthcare decisions for their patients. Time spent in face-to-face encounters with the patient is more efficient. Providers will spend less time gathering data from the patient. It may be a conduit for improved sharing of medical records between providers. The potential to lower chronic disease management costs. Barriers to the PHR. There are differing opinions on what an electronic PHR should be. Should it be generated by the clinician or by the patient? Should it be a combination of both? Should it stand alone with data entered by the patient only, or should it be tethered to a specific health system such as the Veterans Association? There is a lack of a proven business case for the widespread deployment of PHRs. Are they worth the cost? The usefulness of the record relies on patients using the records appropriately and accurately. When patients supply the data, quality cannot be guaranteed. Resistance to change among providers is another barrier to the PHR. There is difficulty in ensuring the integrity of private health information across many different data systems. There is a level of mistrust of the healthcare system by the patient. The feeling persists that personal information may be used against the patient by potential insurers. Inadequate technology literacy on the patient's part. The elderly population in particular are affected, and often this is the population that would most benefit from an electronic medical record. Providers are often unaware of the patient-centered features available in many PHRs and how they may affect patients and their medical practice. Low-income patients may not have access to technology to adequately supply data. Technological difficulties. Too many passwords to remember and login difficulties. A change in provider-patient roles. Both parties will need to develop different mindsets and levels of trust. Providers must learn to encourage patients to enter the information accurately and to learn to trust the information appropriately. Consumers must trust that providers will only use the information for the individual's benefit. Architectural issues affect the widespread use of PHRs. Interoperability issues currently keep patients' medical information separate from other information about them. There is no standardized PHR. Economic and market barriers. Many vendors have not been successful in marketing and selling software and are now no longer in existence. Personal Health Records Measures by Desiree Shensky. Patient satisfaction. When given access to their own personal health records, patients reported 90% satisfaction. National surveys of Internet users specified patients would like to be able to communicate with the healthcare providers through secure messaging and to schedule appointments. Patients also reported that the ability to communicate with their healthcare providers may affect their choice of provider and healthcare system. Provider satisfaction. Providers claim that with the secure messaging, they are able to devote more time to patients and decrease the amount of interruptions, since nurses are able to assist in responding to messages. Providers also stated that message volumes are less than they expected and that they are able to reach patients more effectively than previously with telephone calls. Predictors of PHR use. Early evidence suggests most patients utilizing personal health records are female, middle-aged, have more healthcare requirements, or have providers that use secure messaging. The evidence also shows that most patients that live in lower socioeconomic neighborhoods or have Medicaid insurance are less likely to use personal health records. Utilization and efficiency. The personal health records' increased use is concerning to healthcare professionals. They are worried that it will affect their reimbursements based on the amount of visits. This problem would also affect insurance companies by forcing them to develop a system in which they could justify being reimbursed for online communication and visits. As an example of how personal health records will affect the two, PHRs are expected to help attain better delivery of care for managing chronic illness and prescription refills, which in turn will decrease face-to-face visits. Quality of care. Studies have shown personal health records assist in the improvement of patient care and enhanced health. Zhu. This study showed higher quality of care for diabetes, high cholesterol, and blood pressure for patients that used PHRs. Harris, Hanus, Martin, and Ralston. This study showed that patients who used PHRs were associated with improved control of diabetes. Green and Ralston. These studies showed better health outcomes for those patients with high blood pressure and diabetes than patients that didn't utilize PHRs. Privacy and Security by Desiree Shensky. Education about privacy. The U.S. Department of Health and Human Services states that when educating for personal health record systems, it is critical for the HHS and any other parties to notify buyers the importance of understanding the policies in place for privacy and practices of PHR system retailers. Best practices. The U.S. Department of Health and Human Services states that in order to identify and promote best practices with respect to privacy policies and practices for PHR systems, the PHR model should consist of basic language wording to describe these policies and practices and also be translated so that it may be available in other languages. Health Information Protection and Accountability Act, HIPAA. Also known as the Kennedy-Kassenbaum Bill, it is the first federal legislation to protect automatic client records, and also mandated that all electronic transactions include only HIPAA-compliant codes. Privacy and activities by entities not covered by HIPAA. Entities that offer PHR systems not covered by HIPAA are advised to adopt strict privacy policies and practices, and make certain these are provided in advance to consumers. These policies should also specify in full detail all the uses of PHR data. Security Standards Framework. Consumers should be provided terms and conditions of use for all PHR systems. All PHR systems should provide the capability to consumers to audit who has accessed their information within the PHR. Security Standards Framework. PHR systems should be based on standard security and authentication. Any additional security technology should be portable and supportable. Consumers should be provided with the ability to control who accesses their information within the PHR. Security in HHS activities. The U.S. Department of Health and Human Services should require implementation security protections to be consistent with the HIPAA security rule when sponsoring pilot projects and any contracts produced within PHR systems. The Personal Health Record, The Cost and Best Practice by Sally Sleeth. Cost. The need for personal health records will improve healthcare delivery and help control the cost of care. To understand the potential value of the record, a cost analysis is needed. Currently, only sample models exist. With several alternative approaches to PHRs and no current published model, the estimated cost of the PHR value does not exist. A sample model is used to examine the cost of provider-tethered, payer-tethered, third-party, and interoperable PHRs. The sample model projects the third-party PHRs will be most expensive, followed by interoperable PHRs, and then provider-tethered PHRs, and payer-tethered PHRs being the least expensive. With rising healthcare costs, personal health records are seen as a means to deliver care more efficiently and potentially to reduce utilization. Improving access to care by encouraging the use of electronic communication can potentially reduce overall healthcare costs. This can be seen with a reduction in telephone calls and outpatient visits. With a personal health record, customers can access their information at any time, eliminating the need for costly duplicate tests or procedures. Best practice. Principles of best practice focus on privacy and security and the individual's control of his or her health information and how it is shared. Personal data should not be disclosed, made available, or otherwise used for purposes other than those specified. All data collected should be relevant to the purposes and should be accurate, complete, and up to date. Safeguards to protect personal data against risks, loss, or unauthorized access, use, destruction, modification, or disclosure. Remedies must be available to address security breaches or privacy violations. Consumers should be able to control access to their personal information. They should be able to review the way their information is being used or stored. Consumers should know what information has been collected, the purpose of its use, who can access it, and where it resides.